The Federal Medical Center, FMC, Abeokuta, has urged the federal government to prioritize the nation's health sector by according the medical profession the respect and support it deserves. The call was made by the outgoing medical director of FMC Abeokuta, Professor Adewale Musa Olumu, during a press briefing held on Thursday in Abeokuta, Ogun State. The briefing was part of his account of stewardship, marking the end of his 8-year tenure as head of the medical center. Musa Olumu lamented that the medical profession in Nigeria has been devalued despite its critical importance. He expressed concern over the government's current approach, which, while increasing admissions into medical schools and establishing more pharmaceutical and laboratory facilities, has failed to address the alarming exodus of doctors relocating abroad in search of better opportunities. According to him, a 2025 World Health Organization (WHO) research indicated that Nigeria's doctor-to-patient ratio stands at approximately 1 to 9,083, far below the WHO recommended ratio of 1 to 600. This, he said, highlights the critical shortage of medical personnel in the country. While commending the federal government for its investment in the sector, particularly the establishment of the Federal University of Medical Sciences in Abeokuta, Musa Olumu stressed that more needs to be done to retain skilled professionals.
Governments are really taking measures. They are increasing admissions into medical schools, school of nursing, pharmacy, laboratory technology, and all those. Yes, those increase. I just pray that as they are increasing, it is not that they are increasing the number of health workers that are going to US, UK, Europe. Let them also give us incentives that we deserve. Give us the salary that we deserve, as the colonial masters were doing in those days when they rated us as number 2 immediately after the Governor General. Then doctors will stay. You can imagine all that I've told you that we are doing here. There was a professor from FUNAB. He had breast cancer. I don't want to mention his name. He had breast cancer, and the thing went to somewhere here. Somewhere here is around the 4 or 5 cervical bone. That is the center where we use for breathing. You can imagine this hospital, my doctors separated that cancer from the nerve, from the bone, and the man was breathing again. What were they doing in US? What were they doing in UK? It was here. And how much was the amount? So those doctors, what was their salary?
He emphasized that competitive remuneration aligned with global standards is essential to curb the ongoing brain drain. He concluded by stressing that doctors must be supported in addressing their personal and family needs in order to focus more on patients' care, adding that doctors who are worried about school fees for their children will not be expected to deliver optimal health care at work.